I'm Jared, RN, combat veteran, and diabetes dropout. I'm here this morning because diabetes is dumb, but you don't have to be. I was studying yesterday and I saw a headline and I almost scrolled past it because every day it's like one weird trick will save your life, and then you read to the bottom of the article and it says, maybe, probably not, but it was nice to talk about anyway. So, we've all been burned by these articles or by these studies or by these ads. So, I get it if you get skeptical of headlines. I am too. Um, but stay with me this morning. This one's different, and I'm going to show you exactly why. So, now the headline was this: an 800-year-old Chinese practice just went head to head with blood pressure medicine in a clinical trial and won. Now, before I go any further, here's how you know this isn't clickbait. It's on the screen, right there. This study is called the Bless Trial. It was published February 18th, 2026, in the Journal of the American College of Cardiology. That's the flagship cardiology journal in the United States. Peer reviewed, randomized, controlled trial, 7 medical centers, 216 people in it, a full year. That's not a blog post. It's not someone's opinion. This is the gold standard for medical evidence. And you might be thinking, well, I don't have high blood pressure. Why should I care? A lot of people with diabetes do have blood pressure, but there's more to it than this. So let's talk about the studies. More to it than just blood pressure. So here's what they did: they took 216 adults. All of them were age 40 and older, and they had stage 1 hypertension. So they split them into 3 groups. Uh, One of the groups practiced the Chinese exercise 5 days a week. One group did brisk walking, and one group did self directed exercise on their own, whatever they wanted to do. They tracked these people for a full year. And the Chinese exercise group dropped their blood pressure 3 points on a 24-hour reading and 5 points in the office within 3 months. So those results held for the entire year, matching brisk walking and comparable to first line blood pressure medications. So, what are these Chinese exercises? It's 8 slow movements, gentle breathing, light meditation. It takes about 10 minutes. You don't need any equipment, no gym, no prescription pad. You can do it anywhere in the world. So, here's what I want you to understand about why I'm bringing this up this morning on our morning live. I'm not saying this Chinese method is magic. I'm just saying that this study is a pattern of what the research has been showing for a long, long time. But nobody's talking about this at the doctor's office. So, my expert opinion, in 10 years, things like this will be mainstream. The medications will be last line of defense, not first line of defense. So if you're thinking, you're looking at this article and you're thinking, this is just one study, some Chinese practice, that probably doesn't apply to me. But here's the pattern. The Diabetes Prevention Program is one of the most important trials in the history of diabetes management, medicine, has showed that lifestyle intervention outperformed metformin, the most prescribed diabetes drug in the world. 58% progression to type 2 versus 31%. Lifestyle won hands down. The DASH diet alone drops systolic blood pressure 8 to 14 points. That's the equivalent of a first line antihypertensive medication. This is food, not pills. So, in 2023, a meta analysis in the British Journal of Medicine found exercise comparable to antidepressants for treating depression. Movement, not Zoloft. Dr. Dean Ornish, in his lifestyle medicine program, showed actual reversal of coronary artery disease, not slowing it down. not reversing it, not slowing it down, reversing it. It's now covered by Medicare. So you walk into Dr. Ornish's office and he says, okay, would you like to change your lifestyle, or would you like us to slice your chest down the middle, split your rib cage open, and change all the vessels in your heart? Are you telling me I have a choice, Dr. Ornish? Yeah, I just asked you, would you like to change your lifestyle, or would you like us to open your chest and replace all the blood vessels in your heart? Well, Dr. Ornish, I think I would like to try the first option first. Very good. And they're doing it. They're reversing coronary artery disease in 70-year-old patients with lifestyle, reversing it without opening their chest. Bet your doctor didn't tell you that was an option before you had open heart surgery, but it is. So this is not medical advice, just asking you to start a conversation. So for non-alcoholic fatty liver disease, there's not an approved medication. Lifestyle change is the standard of care. This is an alternative medicine. This is research. It's just not what the system is built to sell you. But this is common sense. And like I said, in my expert opinion, in 10 years, lifestyle medicine will be the frontline treatment. Right now, it's about 15 to 20% of doctors may start talking about this a little bit. In a decade, medicine will be the very last alternative after everything else has been tried. So, a friend of mine left a comment on a Facebook post this week that kind of hit me. She said, a high carb diet is like being constantly cut, and the medication is like one of those little tiny band-aids. The more cuts, the more band-aids. And she was painting the illustration of just being covered with these little tiny cuts and these little tiny band-aids. And that's what's actually happening inside your body. But, I've watched this play out in my own family. My mom was doing everything she was told. Taking medication, eating food most people would call healthy, oatmeal, fruit, whole grains, sweet potatoes, balanced and in moderation. And while she was doing all that, her eyes were getting worse. Her kidneys were taking a hit. And no one was saying anything. Her feet were at risk. Her brain was at risk. The medication was managing her numbers. But it wasn't stopping the damage because the cuts keep coming. But here's the good news. When we changed my mom's diet, got her blood sugar under control, her kidneys started to heal themselves. Her eyes stabilized. Her feet are still attached to her body, And she'll tell you now, she has her energy back. She's done managing this with medications. So, and not saying medications are bad, but if you're using medications, they're a supplement, not the primary foundation of your health. So, and like I said, I'm not saying medication is the enemy, but it's not the solution. The solution is removing what's causing the damage in the first place. One of the doctors commenting on this study said it perfectly. The research gives people hope, and that hope doesn't have to immediately include drugs. That's the diabetes revolution in one sentence. Your body has tools, your lifestyle is medicine, and the research backs it up. So you don't have to wait for a crisis to use it. If you're managing type 2 diabetes or high blood pressure or both, and you're tired of just adding more band-aids, I want to have a conversation. So go over to the diabetesrevolution.com, jump on our YouTube, grab a link, book a free strategy call. We'll look at where you are, where the leverage is, and what a real reversal plan looks like for your specific situation. No pressure, just a little free one-on-one time with me, conversation, so we can figure out the next step for you. So appreciate you watching. Feel free to jump on and look at this article more. Lifestyle medicine has went head-to-head with all of the big major diseases. So I encourage you to look at it more. I'll see you at 5:45 in the morning, as always, because diabetes is dumb, but you don't have to be.